Good morning. My name's Jessica. I'm going to be one of the nurses today.
I'm Jennifer. I'll be the other nurse for today. Right. Can you all tell me your names?
I'm Lindsay. I'm Kevin's mom.
Hi, I'm Christy. I'm grandma.
I'm actually going to move this table, okay? I'm going to smash it here.
You get Kevin's name and date of birth.
Kevin Bale, 8/21/12.
Perfect. All right. So she's saying that you all had some questions.
Yeah, we really don't know anything right now. No one's told us anything. No one's came in and said anything about what's wrong with him. We don't understand why he's not getting better. We don't even know what Kawasaki disease even is.
Oh, okay. Well, it's called Kawasaki disease.
No.
All right. So why don't you guys tell us what brought you in, and we can kind of tell you where we're at.
I'll watch him while she's at work, and he just crying, and we've been telling him Motrin, and it's just not taking care of his fever, and just whining, he wants to be carried.
Okay. So what kind of fever has he been running?
He had 102.8. We took him in after he'd had it for 3 days. We took him into the regular doctor, and they told us just to give Tylenol and ibuprofen.
Can you say that for me? Say ah.
We've been doing that for 3 more days, well, 2.5 more days, and then finally it wasn't going down, and we just brought him to the ER. We didn't know what else to do.
Okay. So you've been giving Tylenol and Motrin that hadn't been helping.
No.
Okay, well, that's one of the typical things with Kawasaki disease. It's gonna have a fever that's gonna run for about 5 days to 2 weeks. And anti-fever medicines aren't gonna, so they're called antipyretics. Those aren't gonna work. So that's one of the reasons why the medication hasn't been working. Has he been eating okay?
He wants to eat, he asks for stuff, but then when we give it to him, he just can't eat it. He just cries and he's upset. His tongue's
My
swollen.
mouth hurts.
Yeah, it looks like he's got some.
Yeah, it was red.
Okay, so it looks like, can you stick your tongue out, bud? Yeah, all right, so it looks like he's got what's called strawberry tongue.
That's what it looks like.
Yep, that's one of the telltale signs of Kawasaki disease. So he's got kind of the red eyes, the red mucous membranes around the mouth, bright red, like kind of chapped looking lips. So that's probably why he's struggling eating. It's probably painful for him to eat. So when they bring his breakfast tray this morning, we're gonna need to look at making sure we've got some clear liquids on board, some softer foods for him to eat.
All right, let's take your board.
He doesn't want to play or walk or do anything. He asked her the whole time to hold him, and
told to hold him.
he's
Well,
really
he's-
active usually.
He's probably got some joint pain going on, and it's usually gonna be on both sides. So like both knees are gonna hurt, you're gonna have both elbows hurt, and so it's probably just painful for him to work.
Does it hurt when we bend your elbow?
Ow.
So he's going to have some joint pain, inflammation. So it's kind of like an autoimmune response. It's causing inflammation in his joints. He's having inflammation going on. So that's part of the reason why he's going to have the pain like that. So
All right.
he's also going to probably be irritable, and that's going to probably last. That can actually last for up to 2 months after the disease resolves. So he may be kind of cranky. just may need to try and keep him as comfortable as possible.
102 for his temperature.
All right. So 102.
He's got a rash all over him. That was the other big
Yeah,
thing.
it's on his
that-
tummy and on his hairy area and stuff, and that's expected with this disease. That will go away. It can last up to 2 months after he goes home from the hospital, and it's not going to be painful or anything, but the skin will be tender.
So we want to look at keeping it hydrated, so lotions and things like that.
Cool cloths.
Which
Yeah.
we'll get some
We'll
of
go get
those.
some, yeah, after breakfast is over.
Now, something else you can do at home to help with the joint pain and the stiffness, you can do what's called passive range of motion exercises. So just while you're in the bathtub with him, help him move the arms. I know it probably isn't comfortable, but I'm sorry, but just do some movements, just help keep those joints mobile so they don't get stiffened up. So, some things I want to ask: is he up to date on his immunizations?
Yes, he is.
Okay, he is 4 years old, so between 4 and 6, he's going to be due for some vaccinations. There are 3 vaccines that you're going to need to avoid though for the next 11 months. So you're going to want to avoid the live flu mist vaccine, no MMR, which is your mumps, measles, and rubella, because that's actually a live vaccine. You're also going to want to avoid the varicella vaccine, which is the chickenpox vaccine, because we don't want to actually give him those illnesses since those are live vaccines. So we need to
And
avoid
we'll write
those.
all that down and give it to you. It's a lot to take in, so we'll make sure you have all that information.
How long is he going to be here? You guys know?
We have to wait for his fever to break first, and after it breaks and we control it, he'll be able to go home and stuff.
So he's going to be on some medications while he's here. He's going to be what's called IVIG, which is gonna help with the immune response. That's what's happening. They don't really know what causes Kawasaki, but they know it's an autoimmune response. They know it's gonna cause inflammation, so that's gonna help stop that response of the swelling.
And that's what I'm gonna hang right now. And we're gonna run it at 40 mLs per hour. And we're just gonna be in here constantly because we need to change the administration, how much we're administrating. It's gonna gradually increase.
Yeah, so like every 15 minutes, every 30 minutes, we'll be in here to increase those. Now, once that goes through, it should help break the fever. If it doesn't, we can repeat it again. So, you know, it can be repeated. So we're in a good spot date and time wise to do that.
So he doesn't have to be on that at home.
No.
Not at home, no.
Now, once he does get home, once he's moved out of the acute phase, we're gonna move into what's called the subacute and the convalescent phase. That's where he's actually starting to get better, but they're gonna have him on an aspirin dose at home. And that's just to help with preventing blood clots because he is at risk for developing acquired heart disease. So we do want to make sure that we're setting you up with a cardiac pediatric specialist. And we also want to make sure we follow up with our follow-up appointments to make sure that we're not developing any problems with the heart later on, okay?
Which is why he's hooked up to the heart monitor, just as a precaution, so we can be up there noticing his heart rate and making sure everything's okay.
So you're going to want to look for signs of heart failure. So you're going to look at suddenly signs of like edema, or he may, you know, start having some facial swelling, you know, things like that. You'll want to, you know, monitor for maybe some changes in signs of heart failure, which is going to be like you're swelling, you know, difficulty breathing, suddenly high heart rate, just kind of cranky, just not feeling very well, possibly a little more tired than he normally is.
And we'll be checking his weight daily while he's here at the hospital as well.
That's a lot to take in.
It is, but if you guys have any other questions for us?
It's a lot to take in. We just want to provide a calm environment for him, keep it cool, you know, keep the simulation down in here, and we'll do everything we can. And if you guys have any questions, ask us. But we're going to go get his breakfast, and he needs to be on soft foods and a hard, healthy diet. And he needs to be drinking plenty of liquids.
Clear liquids, no
Clear
red Kool-Aid,
No red Kool-Aid.
because we need to make sure we keep it up. We don't want any red Kool-Aid while you've got the red mouth. We won't be able to tell when the redness has gone away around the mouth, so.
No cherry.
No cherry either.
No cherry Kool-Aid.